When we talk about medical oxygen, what springs to mind? I think most of us will think back to the devastating images we witnessed during the COVID-19 pandemic and the shortages to medical oxygen experienced then. I think what the COVID-19 pandemic has also demonstrated is the huge amount of deaths that could be prevented if all health facilities had access to this life-saving product. COVID-19 is always associated with medical oxygen. However, it's important to remember that a huge other range of conditions and illnesses also have a need for medical oxygen, and that the need for medical oxygen is a need that predates the COVID-19 pandemic. Medical oxygen is needed for conditions such as sepsis, malaria, COPD, asthma, heart disease, surgery, trauma, during childbirth, and the list really goes on. And medical oxygen is also needed across the life course. It's needed for newborns, for children, for adults, and the elderly.
Yeah, and it's critical that every patient globally that is in need of this life-saving product gets access to the product. It's important that gas companies that produce medical oxygen make this a corporate priority that is driven by the company's leadership.
Yes, because it's important to remember that medical oxygen does not have a substitute, and medical oxygen is on the WHO list of essential medicines, and what that means is that every healthcare facility should have access to this life-saving product. However, we know that that's far from true. And a recent report by the Asian Development Bank demonstrated that 73 million people in low and middle income countries were estimated to have presented to healthcare facilities in 2021 alone with hypoxemia, which is low blood oxygen. Out of those 73 million, 30% were estimated to have presented with COVID-19. However, what about the other 70%? These were patients who presented with other conditions, and these numbers are also expected to be an actual underestimate of the real need for medical oxygen, as conditions such as needing medical oxygen for resuscitation or during childbirth or surgery were not included. And what we do know is that approximately half of healthcare facilities in low and middle income countries are expected to not have uninterrupted access to medical oxygen.
So tomorrow, the Access to Medicine Foundation will publish its research report under the Medical Oxygen Program. And it's important that in this report we highlight the actions that global gas companies have taken to respond to lack of access to medical oxygen during the COVID-19 pandemic, but critically also their long-term and sustainable actions to fill pre-existing gaps that long predate the COVID-19 pandemic. So it is important that medical oxygen maintains a central role in the agenda for global health. In the report, the Foundation assesses companies' actions to secure affordable, available and accessible liquid medical oxygen. And the report provides a consolidated overview of all the activities that companies have been working on in recent years. If you want to know more about this report, please watch our website, our LinkedIn, our Twitter accounts tomorrow for more news and updates.